Hi guys, I am David Adams.
And I'm Jalana Hartman.
And together we are fourth year medical and dental students. Hi guys, it's your boy David Adams again, and I have company today. But how y'all doing? Talk to me. Today we are talking about all things medicine versus dentistry. Yes, for those of you who are thinking, what should I do? Medicine or dentistry? This video is for you. But before I go any further, thank you guys so much for watching my videos. But I need you to continue to watch, to like, comment, subscribe, and to turn on the bell notification for further videos. But before we go any further, I just want to let you guys know that I have an amazing friend here with me today. A really good colleague of mine, really good friend of mine since high school.
Yep.
And now into medical and dental school together with me. And also my cousin-in-law. But don't let me do the talking. Jalana, tell us about yourself.
Hey guys, my name is Jalana Hartman. I am a fourth year medical student at the University of Guyana, School of Medicine. I am 100% Guyanese.
Yes.
I love to eat, but I don't really get fat. And I love music and I love to sing, but I can't really sing that well.
We know this.
But yeah, that's a little about me.
Yeah, and well, it's your boy David Adams. I am also a Guyanese by birth. Well, I am a fourth year dental student at the University of Guyana. Something about myself, I paint a lot, I write a lot, but I haven't really produced anything as yet. I haven't really put anything out there. I should.
You should. Yes.
But yes, that's something about me. I write, I paint, I'm a little bit touchy with my creative side, and I guess that's why I chose dentistry.
I'm not that creative.
The first question many persons ask us as medical and dental students is, why medicine and why dentistry? So let us tell you today. Jalana, why medicine? Why did you even choose to do medicine? Out of all the courses in this world, why medicine?
That's a very good question, David. So I wasn't the typical, I want to be a doctor when I grow up. It wasn't the case for me. For me, until I had finished written CSET, then I was like, you know what? It's time for me to decide to do something. So during that time, I was watching a program called My Baby Story, and they were showing you how is it that babies are delivered and all the complications that mothers can face during that process. And I was fascinated, not by the fact that mothers are through complications, but the whole process of birth.
Yeah.
And from then on, I was like, you know what? I want to make that process simpler and a beautiful experience for mothers. So that's why I decided to do medicine, so that I can pursue my dreams of becoming an obstetrician.
That's so nice. I've never really heard somebody's testimony about why medicine so deep, so cool. Bam, my friend. So that's really good. I really like that it wasn't just about I want to become a doctor, but it was about the making the experience better for persons, for patients. And that's really good, Jalana. Kudos to you. For me, why dentistry? Now let me tell you something one thing. I didn't always want to do dentistry. Like, who does wake up and say, I want to be a dentist? Not me. So I didn't had it all the time that I wanted to do dentistry. I wanted to do medicine as well. I knew I always wanted to become a doctor, but I didn't know which type of doctor. But I wanted to do dentistry because I realized that I am really creative. Like I said earlier, I paint. And dentistry was where the art meets the science. Like, I saw how much transformation would have occurred in dentistry. Like, for example, many persons would have come with crooked smile, and I would have seen these dentists just put together these instruments and just do their work and cause that patient to get this beautiful smile. I don't have the perfect teeth. Ask my friends. I have messed up teeth. I have messed up teeth. Spaces all over the place. But my thing was that I love the transformation and the whole new changes that dentistry involves. And the fact that, dentistry, the results are usually on the spot. For example, if a patient comes with pain and you have to do an extraction, the pain is done immediately, as compared to medicine where you have to like see the changes after a period of time. And I like quick results. I like to feel good in the moment right away. And dentistry satisfied my needs with that. So that was one of the things why I really love dentistry, because of the art involved and the positive change that occurred immediately, you know? So I didn't always want to be a dentist, but is it? No. Is my thing? No. Is my baby?
I can tell. I can tell.
But Jalana, question, many persons may ask also, how can I get into dentistry, or how can I get into medicine? How did you get into medicine?
Okay, for me, well, persons may think of it as the long route, but I did 2 years of CAPE at the St. Stanislaus College, one of the best. And then I used my CAPE grades and I applied to medicine and I got in. Of
Great.
course, your CAPE grades must be good.
Sky
Must
high.
be high, right? Yeah.
I think it's grade 1 to 3.
Yes. You need grades 1 to 3 in biology, in chemistry, and in 2 units of maths. You can do pure maths, and I believe they added integrated maths as well. So you can use those to get into medicine. And if you don't want to take that route, if you're already in a health science program that is in pharmacy, or you're doing medical technology, you can still apply to medicine. Once you've completed your degree and you got a really good GPA, you can go ahead and apply to medicine, and I'm sure they'll accept you.
Definitely.
Yes.
It's the same for dentistry as well. You can do CAPE and you can do a full degree program at the University of Guyana or any university. Once it's a health science program and it's a full degree. You can also get in with an associate program, because that's how I got into dentistry. I did an associate in chemistry, that is 2 years at University of Guyana. And of course, your GPA must be high as well for dentistry. The minimum GPA that they usually accept is usually 3.0, depending on how well your interview is and how well your essay that you wrote is good, then they accept you. But for medicine, you have to get 3.4 and above, period. Period. So, that's about it on how to get into dentistry or medicine. So, apply.
Yep.
Do the thing, man. No frighten.
And all the hard.
Wow. So the programs are 5 years. So both medicine and dentistry is 5 years. There is a 3 years preclinical, or 2 years preclinical, and then 3 years clinical.
Yeah. 2.5.
Yeah, about 2.5 preclinical and the remaining clinical. So the first 2 years or 2.5 years, Jalana and I would have spent together in classes together. We did the same courses and everything. And then the remaining years, from 3rd year to 5th year, we branched off with our specialties and we were separated. But the first 2 years were very challenging. So we have challenges in medicine and in dentistry.
Yeah.
We did the same courses. We did about how many courses? About 9, 8, 7? I think the first semester was about 7 courses or 8. Not sure. Around there. And then we would have branched off afterwards and did our own particular courses. But what are some challenges that you had, Jalana, in the first 2 years?
Woo. So I came directly from CAPE, so I had this whole, study, cram to pass kind of mentality, push all my work to last minute, and still did well.
Yeah.
It was not that for medicine at all.
Period. At all. And dentistry was not.
It was a whole new ballgame.
Yeah, definitely.
This whole university life, studying on your own. It was tough for me. It was very tough. And the content for medicine is a lot. I didn't even think my brain could have hold all of them things. Yo.
Yeah, like so we had to do a lot of reading. Like I remember staying up weird hours just to reading because there was this one doctor. Should I call her name? No?
She's a real OG, man.
Yeah, Dr. Martin. She was amazing. Like her work was descriptive anatomy, and anatomy is very perplexed. Like it was a lot of nerves. You have to memorize a lot of muscles.
Origin, insertion.
Oh my gosh.
Where it innovate.
Damn, it was a lot. So we had to always be on the go and always had to be on our P's and Q's.
I remember Dr. Martin you know, she always with the quizzes, right?
Oh my gosh.
I remember staying up all night,
Yeah.
whole night into the morning just for a quiz.
And every single class was a quiz for anatomy.
Yep.
Every class was a quiz. So you had to be reading the class that you had today and the class for the class the next day.
Yep.
And the PowerPoints were very tedious. There was a lot of things. Man, listen, this thing was very challenging,
Look.
but here we are today, 4th year medical and dental student days.
And that is something that we should let them know. Even
Yes.
though you're doing medicine and dentistry, and even though it's tiring, it's a lot of pressure, always remember to take time for yourself.
Yes, definitely. It is important that you take good care of yourself. You matter. If you
Yep.
read, if you cycle, if you watch series to relax, if you do painting.
Don't stop none of those things. You continue doing those things, but you just have to learn now how to.
Prioritize.
That's it.
Yeah, prioritize exactly what is it that is important before you just go and say, oh, Jalana and David say I could go and go to a movie or go to a party. Yeah, but you gotta prioritize. Because it is important for you to take good care of your mental health, because mental health is very serious
Yes.
in dental school and medical
Medi-
school.
Mhm.
So you gotta take good care of that. So whatever it is that is necessary to ensure that you stay sane, do it.
Yeah.
Go to a movie, go with your boyfriend, your girlfriend, do whatever is necessary. I know there are many thrilling and exciting experiences that we would have had in medicine and dentistry. You have any?
Oh, yes. Remember during our preclinical years, we did pathology with Dr. Nancy. Shout out to Dr.
Oh, yes.
Nancy. She is amazing. And so at one point of the course, we had to attend the morgue.
Oh yes, in the morgue, in
So-
pathology. Let me just take a pin.
Yeah.
So we had to go to the morgue in pathology. And listen, let me tell you something. The morgue, there are people all over the place. Of course, you have to wear protective gears. So we had our nice long boots on our raincoats. And we used to wear extra protection, plastic bag.
Them extra large garbage bags.
Yeah, and wrap it around your head. And it was so cool just going to see these things. But talk the story.
So this was our first session in the morgue. So we were in front of a dead body, and Doc was showing us, you know, how is it that they would cut, and she was showing us the different organs, how they would normally look in real life.
Okay.
It was pretty cool.
It
But
was.
a few of my classmates, they were touchy, and so they were feeling, and of course their hands were nasty. And one of them, they were going to touch me with the hand. Well, I saw it coming, and so I decided to avoid being touched, backed up, and all of a sudden, I felt something poke me in my back. When I turned around, was a dead man's foot. I almost screamed like I wanted
did
to
faint. I would
scream,
have
I
faint.
wanted to cry, I wanted to vomit all in one. But
You survive.
I
You
survived.
survive. My thrilling experience in dental school, that was one of the most amazing things for me though, by the way. In the morgue was really, really thrilling. I remember after going to the morgue, like I could still see the dead people in my head kind of. But after 3 weeks after, like I get over that. But for me, one of the most thrilling experiences to me was in dental school was when I had to first administer anesthesia or to give the injection. Now let me tell you something. This is the first time I'm now going into somebody's mouth. Well, actually, we had to first go into our colleague's mouth. We had to give the injection to our colleagues first. Yeah, and then, because it's colleagues, and we're all here to learn. So yeah, Akeem was my partner.
Hey!
So we had to inject each other first. And when you inject each other, you have to learn the nerves, where to inject. And it was really, really cool. And you had to inject each other. That for me was really cool. But then you see, when I had to go into a patient that I know that I can get sued, that I know that might kick up or crowd, because my colleagues, we all knew that, everybody got to pass this course. So Akeem didn't really fight up much or so. But you see the patient, I did frightened bad. So my hands, this is me. I remember Dr. Hardy Quinn saying, hi Dr. Hardy Quinn, if you're watching this, shout out to Dr. Hardy Quinn. I remember Dr. Hardy Quinn telling me, Mr. Adams, take the needle and inject into the IAN nerve. Come on, the inferior alveolar nerve. She's like, ensure you inject properly. I'm like, okay, and this is your boy. This is your boy. And that thing was really, really scary. But then she guided me into the tissue, and it was just amazing. And I injected it, released the lidocaine into the person, and then they were like, well, to know if you did it really well, you had to ask the patient, are you numb? And then they said yes, and I felt like, whew, thank God, because one of my fear was that if I inject a wrong nerve, and what if I damage some other structure, I would be in the sauce. So that was my problem. That was one of the most thrilling things. But now as a boss, as an injection boss.
Big up yourself.
So yeah, that was one of my thrilling experience. So before we go, Jalana, let us just encourage the viewers who might have ideas of doing medicine or doing dentistry, but you're kind of confused. Let's just encourage them. For me, I just want to say, if you're going to do it, make up your mind that, hey, I'm going to do dentistry, but I'd advise you, do not apply for dentistry if you're going to do it for the money. Don't do it for the money, and don't do it for the title of doctor. Don't. What you need to do essentially is do it for fulfillment.
Yeah.
Right? Because what I always tell myself when I'm treating a patient, David, you're not treating the disease per se. You're treating a patient with a disease. Because if you treat it as a disease wholesome, what you find happening is that you just stick to what the textbook says.
Yeah.
The textbook says, oh, cut here, cut there, take out there, then you just do that. But if you know that, hey, I'm dealing with a patient that has feelings, emotions just like me.
Exactly.
When I treat the person as a patient with feelings and I have empathy, then I'm able to ensure the patient is comfortable, and I'm able to ensure that the patient says, hey, I had a really good experience with you and I'd want to come back with you. And that is my main thing. I always ensure that, whoever I'm treating, you want to ensure the person have a really good experience with you. So that's my go-to thing all the time when it comes to advices for dental students.
Well, for medicine, I would want to agree with David in that you don't do medicine for the money, because it wouldn't be fulfilling for you, and you would just focus on the disease itself.
Yeah.
For medicine, you have to do it because you love it. You love helping people, and you love, probably love the little excitement or diversity that comes with medicine, but just do it because it's something that you're passionate about. And for those that are students that are already in medical school, I know it's tough, it's a lot of work, but you can do this, because you know what? Before you even applied to medicine, it was something that you wanted to do. Definitely. Just remember why you started, and so you will be able to be motivated and continue that pathway so that you can get where you want to go.
Exactly. So for those of you who are in medical school and dental school, keep at it. I just want to shout out a few of them. Shout out Adia Gomes, Petra, Russian Taylor. Shout out to
Crystal Barkley, Tawan Ramdio, my girls.
Yes, I just want to shout out a few of my colleagues, Aki Marks, Danish Prasad, Tresia Ketwaru, Chiquita Forrester, Keisha
Crystal Lee, Mitra Rocky.
So we just want to encourage you to, if you're in medical school or if you're applying to medical or dental school, just keep at it. Remember what you're applying for, do it for the right reason, and you're going to become very successful. But again, it is a journey. You will cry a lot. You will laugh a lot. You will have sometimes
you want to pull out your hair, and sometimes there'll be times that you'll shine because the doctor asks you a question, you answer,
you feel good.
You feel good about
But sometimes you get everything wrong, you get joke, and that's fine.
And sometimes you might get zeros on your quiz, but all of that is all
first
part
year
of
quizzes.
Yo.
All, no, not all, a few
of them. It's all part of learning, and trust me, you'll get past it. And you never know, there will be this one patient that you treat and They'll always remember you.
Always remember you. Yeah, but before I go, the most important thing as well with all of this, Jalana, is you need to ensure that you have a really good support team. Your family and friends, they play a key role in your medical and dental school. I have some amazing friends that always call and check up, and that usually go through it with me, that study with me and everything, and that was what kind of pushed me to continue the program. You know, my family as well, they would also push me, and I have friends and strangers that even on social media would say, hey, keep up the good job, and things like that. And it's most of the times I realize is the people you don't even know is Gaia back a lot of times on social media. So shout out to y'all that are watching, that is support us. We appreciate y'all so much. The people from church and everything, they always support you. So ensure you have a really good support team when you're applying for anything: dentistry, medicine, engineering,
law, anything,
whatever. Yeah, and since you're talking about law, I have some really good, amazing law friends that would have encouraged us a lot. Melissa,
oh my god,
and Delante, they were just amazing. They
I
usually
miss Melissa's
same. Like we used to always just meet up together in the library and study.
Yeah.
And it was good. So support team is important.
It's very important. And always remember you are a person. You have feelings to take care of your mental health, your physical health, your emotional health, all aspects of health.
Yes, definitely.
Take care of you.
Definitely. And so without further ado, I just want to say thank you so much, guys, for watching. We really enjoyed doing this video.
Thank you for having me, David.
It's fine. And I hope you guys enjoyed this video as well. But before you go, remember to like, comment, share, and turn on the notification button so that you can always see my posts. So until next time, bye guys. I am David Adams.
And I'm Jalana Hartman.
And together we are your future dental surgeon
and obstetrician.
Yes.
Speak it into being. Dr. Adams, Dr. Hartman.
Bye.